Hi there. Right, in this video, what we're going to be doing is looking at vaccination and vaccination programs and the efficacy around these particular programs and how good they are at dealing with infectious diseases and who they're suitable for, and some evaluation around why they might not be taken up as much as they should be. Now, what I wanted to do to start with, though, is just trying to draw your attention firstly to this article that was in the news yesterday, and this is about plasma treatments to be trialled on the current coronavirus crisis, and it's going to work on the idea that essentially you're going to take the blood of coronavirus survivors and infuse the blood into patients that are currently ill with the disease. And the key question really about this is, how is this going to work? And the answer to this, it lies in these things here, these things called antibodies. Now, antibodies or immunoglobulins are produced by plasma cells. Plasma cells are essentially immune cells that develop the ability to produce the antibodies that are specific to the coronavirus or the virus in name, like essentially whichever virus it is that you're looking for. By infusing these antibodies into a patient that doesn't have that immunity, we could potentially be able to either prolong that patient's life long enough for them to develop their own immunity, or we may even cure them of the disease. Scientists are quite careful about the use of blood plasma. They're keen to stress that this isn't a cure-all, this isn't going to be a silver bullet, but it could give them enough time to begin to develop essentially what is going to be the best way out of this crisis, and that is a vaccination. Now, vaccinations are really important in terms of modern medicine, in terms of extending life expectancy and in terms of reducing the impact of infectious disease. Now, what is a vaccination? Well, to start with, we have to understand that a vaccination is essentially a way of training the immune system to deal with specific pathogens. So, generally speaking, immunizations are specific to a single pathogen. It's a deliberate exposure of the body to antigenic material. So what do we mean by antigenic? What we mean by antigens are essentially on the surface of any cell, and you can see this on this yellow blob here on the right hand side. There are little cell surface markers, and these are called antigens. And antigens are specific to every single cell and viruses. And essentially, antibodies are able to attach to antigens, triggering what essentially is the immune response. Now, the immune system treats the antigenic material as a real disease. So this is what we mean by a training ground, and we're going to talk through in a minute the different types of vaccinations. Now, as a result of this kind of triggering of an immune response, antibodies and memory cells are produced inside your immune system, and this is what gives you the long-term immunity to that pathogen. Now, there are different forms of vaccination. It depends on the virus or the bacteria or the pathogen that we're trying to immunize against. Some vaccinations will contain a whole live microorganism, either similar to but not as harmful as the actual target pathogen. And this was the case in the smallpox vaccination. They used the cowpox pathogen to treat the smallpox vaccine virus essentially, and it worked really effectively, and we actually have eradicated smallpox from the wild, which is really good news. Some vaccinations use harmless or attenuated versions of the pathogen. Attenuated just means kind of weakened, reduced in number in terms of its intensity. It may just be about introducing a small amount of that pathogen into the body. And this is the case with the measles and the TB vaccinations that are available. Some vaccinations are able to use a dead pathogen. So in this case, what we'll do is we'll probably autoclave, sterilize the vaccination completely. In this case, it works well with bacteria. You can kill the bacteria, but its antigens are still present. So typhoid and cholera vaccines work on this. They're not always that effective, but it is an option. The fourth option is a preparation of the antigens from a pathogen. So what we'll do is we'll just remove the antigens from the pathogen and just include that in a serum that is injected into a patient. This is the case with the hepatitis B vaccine. The last option is to include a harmless toxin, and this will be a toxin that's essentially called a toxoid that is produced by the pathogen. In this case, the tetanus vaccine works on this basis. So there are a range of different vaccination forms that exist, and it'd be worth making sure that you include these in your assignments. Now, how do they work? Vaccines work essentially by the antigenic material from the pathogen is introduced into the body, and the body will aim to create antibodies to fight these particular substances. The idea is then to give the patient immunity if they come across this pathogen again in the future. So it's mainly about that kind of longer term immunity that they can develop. They essentially protect the individual from future infection, and that is the kind of the crux of a vaccination, is about the individual. But actually, the other important aspect of a vaccination and a vaccination program is to offer wider protection to the community, and this can be achieved in two ways. The first is herd immunity. Herd immunity is achieved by vaccinating all or almost all of the population. So you need really widespread coverage of the vaccination program in order to achieve herd immunity. And at present, the UK does vaccinate against a range of different pathogens, including TB, diphtheria, tetanus, mumps, measles, rubella, in the form of the MMR vaccination. They're quite costly, but it does provide you that really widespread coverage. Now, the other option is something called ring immunity. Ring immunity involves vaccinating all the people in the immediate vicinity of a new case. So in this case, you need to trace the people that the case had been in contact with, and you'd have to contact them, quickly get them vaccinated, and then that could be quite a number of people. Now, the way these two processes essentially work, herd immunity is demonstrated in this image here. At the top, you can see that no one is immunized, and there are two people who are red, who are sick and contagious, and they spread the virus very quickly amongst the population. This is very similar to the coronavirus in the sense that if we don't currently have an immunization against it, therefore if we did all spread the virus would spread amongst the population very, very, very quickly. In the middle image, you've got a couple of people immunized, but as you can see, generally speaking, the spread is quite fast. At the bottom, best represents herd immunity, and this is where the bulk of the population have been immunized, and in the image to the bottom right, you can see the spread of the contagion essentially is contained. It's very small. What we find with ring immunity is this is just about finding an infected person and just then vaccinating those people immediately in the vicinity of them. So you may include their community, where they live, where they work, who they socialise with. This can be quite effective if trace programs and surveillance is in place, but it's obviously difficult to know who exactly an infected person has come into contact with, especially if they've got on a bus or a train or something like that, and they may well have spread that contagion to people that you just won't be able to find. Therefore, ring immunity can be useful, but it does depend on the virus or the bacteria that you're trying to vaccinate against. Now, how effective are vaccines? So the efficacy of vaccines are well demonstrated in this image here. So this image shows essentially the pre-vaccine era morbidity of various diseases in the US. So this is prior to the vaccines being put out into mass use. On the right, it shows the most recent reports of cases in the US. And what you should be able to make out is actually that the vaccinations have had a really big impact in reducing the number of cases. In most cases, for example, like diphtheria, there have been 0 cases in that particular country. So the vaccination has completely wiped out that particular pathogen in that particular region. So we can see here, this is numerical data that shows us the efficacy of vaccinations. So what we do notice, though, is that there are some worrying trends that exist. And this is one particular worrying trend, is the number of measles cases. And this is in the US in this particular case. But we need to understand that this actually is being seen in countries like the UK as well, in that the number of measles cases is increasing, and you can see this increase here on the graph. There was an increase in 2014 in the US, and this was within one community, an Amish community. And what we'll find in that particular community is that there will have been a reduced uptake of the MMR vaccination, or the measles vaccination, and that's why we're seeing that particular trend. Now, why might someone not get a vaccination? There are a number of valid reasons not to get a vaccination. For example, you may be allergic to the ingredients within the vaccine. Pregnant women aren't encouraged necessarily to get vaccinations in this particular case. Immunocompromised people who don't have the immune response to be able to deal with the vaccination, certainly not encouraged to get vaccinations. People with blood conditions, people with underlying infections, so perhaps someone with TB would not be encouraged to necessarily get a vaccination. And also people who have had another vaccine within the last 4 weeks, and this certainly is the case for children who have a lot of vaccinations within their first couple of years. You shouldn't be putting too many vaccinations into a patient. All of the above are at risk of being infected by a target pathogen because they cannot be immunized against it. So they are at risk, essentially. Some may be long-term at risk, especially those who are allergic to an ingredient. They cannot ever have that vaccination. Some may be a shorter-term at-risk time. So shouldn't herd immunity protect them? That's the key question here. And the answer is yes, essentially, herd immunity should protect them if enough people get the vaccination. And here it is the current, or the most recent data in the UK that shows the percentage of children who have completed the first dose of the MMR within their first 2 years of birth. And as you can see, at the moment, we're at 90.3% coverage in the UK. And this has improved from the middle of the graph, where you can see we were down to about 80%. And I'll talk about why that is in a minute. But we have actually seen a small reduction since about 5 to 10 years ago. And as you can see, we're completely below the World Health Organization target of 95%, which is really the number you need in order to achieve that herd immunity. So these people are at risk, and there is a risk that measles may begin to spread through the population. Now, why is there this reduction that we can notice in the MMR uptake? I kind of wanted to just finish by talking about the damage that was done by this particular doctor. This is Dr. Andrew Wakefield. He published a piece of research in the 1990s that suggested a link between the MMR vaccination and autism. And what subsequently came up as a result of this was a kind of media frenzy that led to a reduction in the uptake of the vaccination. And further to this, there was evidence to suggest that this particular doctor had a conflict of interest. He honest in the way that he'd done his research, and his research was essentially retracted by the journal, the Lancet, that it was put in. Now, the damage was already done. Wakefield was struck off the medical record. His research was retracted, but people had picked up his research and they had run with it. And the anti-vaxxer movement still quote his research to this day as a reason why vaccinations are not safe for people. Now, it's really important to note there has never been any evidence to suggest that his research was reproducible, or that there is a link between the MMR and autism. But the damage is done, and we can see this in the data here. We can see that the MMR uptake fell to around 80%, and the damage that this did over time was quite vast. Now, that concludes this particular video. What I want you to begin to think about with regards to your assignment is looking at the analysis of vaccinations in terms of how good they are, how effective they are, and perhaps thinking about why people might not take them up as readily as they could do. So, all the best with that one.